In Module 3, we're going to talk about communicating with residents with Alzheimer's disease. We're going to learn about how Alzheimer's affects communication skills, strategies and guidelines for verbal and nonverbal communication, strategies for communicating with residents who are non-communicative or non-responsive, and we're also going to learn about a technique called validation therapy and how to use it with residents with Alzheimer's. So let's get started. Communication is very hard for people with Alzheimer's disease because they have trouble remembering things. They may struggle to find words or forget what they want to say. And you, as a caregiver, may feel impatient and just wish that they would say what they want. But the reality is that they can't. Now, changes in the ability to communicate can vary and are based on the person and where he or she is in the disease process. Now, problems that you can expect to see throughout the progression of the disease include difficulty finding the right words, using familiar words repeatedly, describing familiar objects rather than calling them by name, easily losing a train of thought, difficulty organizing words logically, reverting to speaking a native language, so maybe their native language is Spanish, speaking less often, and relying on gestures more than speaking. In the mild stages of Alzheimer's, usually somebody is able to participate still in meaningful conversation and engage in social activities. However, he or she may repeat stories. They might feel overwhelmed by excessive stimulation or have simple difficulty trying to find the right word. So there are some tips for successful communication during this stage. So don't make assumptions about a person's ability to communicate because of an Alzheimer's diagnosis, because the disease affects each person differently. Don't exclude the person with the disease from conversations. Speak directly to the person rather to his or her caregiver or companion. Take time to listen to the person express his or her thoughts, feelings, and needs. Give the person time to respond and don't interrupt unless help is requested. Ask what the person is still comfortable doing and what he or she may need help with. Discuss which method of communication is more comfortable. This could include face-to-face, email, or even phone calls. And it's okay to laugh. A lot of people use humor to lighten the mood and it makes communication easier. Also, don't pull away because your honesty, friendship, and support are important to the person. Now, as we get into the middle stages of Alzheimer's or moderate Alzheimer's, this is typically the longest and can last for many years. So as the disease progresses, the person will have difficulty communicating and will require more direct care. So successful communication during this stage includes engaging the person in one-on-one conversation in a quiet space that has minimal distractions. It's also very important to speak slowly and clearly. It's important to maintain eye contact because it shows that you care about what he or she is saying. Give the person plenty of time to respond so he or she can think about what to say. Be patient, of course, and offer reassurance. It may encourage the person to explain his or her thoughts. Only ask one question at a time and ask yes or no questions. For example, would you like some coffee rather than what would you like to drink? Of course, avoid criticizing or correcting. Because remember, this is all part of the progression of the disease. Instead, listen and try to find meaning in what the person says and repeat what was said to clarify. And don't argue with somebody with Alzheimer's. If the person says something you don't agree with, just let it be. And offer clear, step-by-step instructions for tasks. Lengthy requests may be simply overwhelming for the resident with Alzheimer's. Give visual cues and demonstrate a task to encourage participation. And written notes can be helpful when spoken words seem confusing to the person. Now, getting into the late stages of communication in Alzheimer's. This is referred to as severe Alzheimer's, and again, it may last from several weeks to several years. And as the disease advances, the person with Alzheimer's may rely on nonverbal communication, such as facial expressions or vocal sounds. And unfortunately, around-the-clock care is usually required in this stage. So a lot of times this is when the person enters into a long-term care facility. So how should we communicate with somebody with severe Alzheimer's? Well, approach the person from the front and identify yourself. Encourage nonverbal communication. If you don't understand what the person is trying to say, ask him or her to point or gesture. Use touch, sights, sounds, smells, and tastes as a form of communication with the person. Consider the feelings behind words or sounds. Sometimes the emotions being expressed are more important than what's being said. Treat the person with dignity and respect. Avoid talking down to the person as if he or she isn't there. It's okay if you don't know what to say, because your friendship and your presence are the most important thing for that connection. Let's discuss some strategies for communicating with residents who are non-communicative or non-responsive. These nonverbal dementia communication techniques can make caregiving easier and improve the quality of life for all of you. So there are many, of course, different types of nonverbal communication, and this includes facial expressions. Your face can express emotions without saying a word. And many facial expressions are the same across cultures, like happiness, sadness, anger, surprise, fear, and disgust. Body movements and posture are another type of nonverbal communication. The way someone moves and carries themselves can say a lot about them, their mood, and their state of mind. Gestures, even as I'm sitting here doing this webinar, I'm using a lot of gestures. When we talk, we use gestures without even thinking about it. Waving, pointing, using our hands when we're angry or excited. Also, eye contact. For people who can see, vision is the dominant sense. That's why eye contact is so important. The way you look at someone can say a lot. Plus, eye contact helps you to see the other person's engagement levels and reactions. Touch is another way to speak without using words. For example, these mean very, very different things. A limp handshake, a gentle shoulder tap, a warm hug, a reassuring pat on the back, a patronizing pat on the head, or a controlling grip on the arm. Remember, when touching a resident with Alzheimer's disease, you must use professional and ethical standards while taking into consideration the person's religious, cultural, and personal preferences. Space. Everyone needs some physical space, though how much may vary for each person and situation. For example, standing too close can make somebody uncomfortable, but staying at too far a distance could seem uncaring and uninterested. The voice, of course, the tone and volume of your voice adds a lot of meaning to words. For example, imagine saying fine during a heated argument compared to saying it when you're happy and content. The same word sounds completely different and communicates something different. Pain is a frequent symptom in residential aged care, with up to 80% of residents experiencing pain at some point of time, while at least 50% of those with dementia have pain on a regular basis. Pain often is under-detected and undertreated, particularly in those with moderate to severe dementia who can no longer self-report pain due to all these changes within the brain associated with the condition. An alternative communication channel to report pain for these residents is through nonverbal signals. Nonverbal communications were recognized by the American Geriatric Society in 2002 as indicators of pain, and since have been recommended for inclusion in behavioral pain assessment tools. Patients with Alzheimer's disease have been shown to display an increase in the frequency and intensity of facial activity. Here's an example of a pain assessment tool. It's called the Abbey Pain Scale. This instrument consists of 6 subscales: vocalization, facial expressions, a change in body language, behavioral change, physiological change, and physical change. Nonverbal communication is vital. Touch can be used to stimulate senses and provide reassurance. Remember, when touching a resident with Alzheimer's disease, you must use professional and ethical standards while taking into consideration the person's religious, cultural, and personal preferences. Try to achieve eye contact. Be aware of the tone of your voice. Remember that the expression on your face will convey more than the content of your words. At this stage, it is worth considering alternative forms of stimulation to make a connection. Smell. The sense of smell is very powerful. Scents and smells can create a link and bring back reassuring memories of times gone by. For example, the aroma of baked bread or a favorite perfume or flowers. Having these close by can produce a reaction and a connection. Touch. Holding hands, stroking a person's face or arms, or brushing their hair can be soothing and be pivotal in making a connection. A woman may like the feel of a silk scarf on her neck. Vision. A family photograph or a picture of a favorite view can produce a reaction, perhaps encouraging the person to open their eyes and reach out. Music, playing or humming favorite tunes can bring back happy memories. Someone who lived in the countryside may react to birdsong. If they lived by the coast, sounds of waves crashing on the shore may lift their spirits. Music can lead to finger or foot tapping, a smile, or perhaps a tear. Often people with dementia who stopped speaking a long time ago can sing along to a familiar tune, remembering the words. Dancing and movement. Depending on their mobility, the person with dementia may connect through dancing. Perhaps they will get up and move around or put their arms in a familiar dance hold or even move their feet to the rhythm of the music. Art can also be a way to connect. It can be made through art by the simple sensory act of holding a brush or pencil and scribbling, painting, or drawing on paper. Now we're going to talk about validation therapy. This was created between 1963 and 1980 by Naomi Fiel. Fiel spent her childhood living in a family home for seniors and found herself frustrated with many of the common, quote, therapies available for Alzheimer's. Validation therapy involves communicating with people who have dementia in a way that acknowledges their words and actions with respect and empathy, rather than with embarrassment, anger, or dismissiveness. So how does validation therapy work? According to her book, The Validation Breakthrough, validation therapy follows 10 basic principles. Number 1 is that all people are unique and must be treated as individuals. All people are valuable, no matter how disoriented they are. There is a reason behind the behavior of disoriented old people. Also, behavior in old age is not merely a function of anatomic changes in the brain, but reflects a combination of physical, social, and psychological changes that can take place over the lifespan. Old people cannot be forced to change their behaviors. Behaviors can be changed only if the person wants to change them. Old people must be accepted non-judgmentally. Particular life tasks are associated with each stage of life and failure to complete a task at the appropriate stage of life may lead to psychological problems. When more recent memory fails, older adults try to restore balance in their lives by retrieving earlier memories. When eyesight fails, they use the mind's eye to see. When hearing goes, they listen to sounds from the past. Painful feelings that are expressed, acknowledged, and validated by a trusted listener will diminish. Painful feelings that are ignored or suppressed will gain strength. And empathy builds trust, reduces anxiety, and restores dignity. The most important part of validation therapy is listening. By listening attentively and responding respectfully, you validate the person with dementia by showing your willingness to enter their world rather than trying to force them into yours. How can validation therapy help dementia patients? Well, it can improve the lives of people with dementia by helping them feel listened to and appreciated. It can prevent them from feeling dismissed, which can help them avoid anger, arguments, and other negative feelings or behaviors that people, especially those with dementia, are more likely to display when they feel disrespected or misunderstood. Validation therapy may make people with dementia more communicative and less withdrawn, improve their sense of humor, and even slow mental deterioration. Those improvements, of course, in turn, can reduce stress for caregivers. Validation therapy can also help caregivers better understand any underlying issues that are contributing to a loved one's unusual behavior. So I'm going to use a real situation that I used to go through with my grandmother. My grandmother, who had Alzheimer's disease, lived in a long-term care facility, and she grew up on a farm, and she was frequently worried about the horses getting fed. According to the Validation Training Institute, people who practice validation therapy can use the following techniques, and I'm going to apply that to this real-life situation. Now, keep in mind that I did not specifically use all of these techniques, but as I go through it, I actually did learn a lot of them in nurses training. So the very first thing I needed to do when my grandmother, who was 96 years old, nervously started calling out loudly because the horses needed to be fed. So the very first thing I would have needed to do is center myself. Take a deep breath and slow down, because the initial reaction is usually trying to use logic. But before one reacts, they need to think and breathe. It's also important to match and express the emotion. So joining with my grandmother in her feelings of worry. Oh, wow, Grandma. Yeah, the horses need to be fed. And it's also important to acknowledge hallucinations positively, but not directly lie to people. Now, this is where I may have fallen a little bit short, because I would inform my grandmother that the horses had all been fed and had been taken care of and that everything was all right. Now, this isn't exactly telling the truth, but it did calm her down, and then I would try to redirect her. And I really would reminisce with her, asking my grandmother, what life was like on the farm with her parents and brothers and sisters and what she missed about it, and sharing memories about her life. Also, one can rephrase. Rephrasing her feelings back to her can provide reassurance that one understands her worry. And of course, using the senses, and I didn't specifically do, but maybe I could have asked questions about her life on the farm. Well, I did do that, but how it smelled and how it felt to grow up on a farm. It's natural to respond to unusual behavior with discomfort. But the next time you feel yourself about to respond to somebody with dementia by rolling your eyes, cutting them off, or chastising them out of uneasiness or embarrassment, give validation strategies a try instead. You may find that open ears, a smile, and a nodding head can make life better for both of you.